So what are y'all coming in today to learn? Do you all have an idea? Anybody?
Breaking bad news.
Okay. What do you understand by that? Whatever you think in your mind, I want you all to be verbal. I want you all to be open. Only then, so many things that we have in our mind, which may be correct, wrong, we don't know what it is. So let's get together and understand what we are going to be getting into. All right. So what do you understand by the term breaking bad news?
And informing the family members or the caregivers that the child is diagnosed with cancer or life-threatening diseases.
Okay. Anybody else?
The way you deliver the news, ma'am. Do not let them know that is bad news and good news, maybe.
It's the way you deliver it. Yeah. Okay. Yes, Dennis. Anybody else? Give me some more thoughts.
Kind of an approach, how you deliver it. The do's and the don'ts of telling something to the parents that may be sensitive, that may affect them because it's their children.
Correct. Okay. And do you tell everybody about this, or what do you think? How do you go about it?
Parents, maybe you can tell, but not everyone. Maybe other professionals, maybe you can share the information if it's very confidential.
Okay. Okay. Coming back to yesterday's class, what was the thing that you all took back after the session with Rama? Something that was very important that you all need to carry on with you all for life. This is something that you all will have to, I won't say by heart, but bring it into practice into your daily life. So what was that one thing that you all went back, which is going to help you all today? What do you all think? What each of you all think could that be? We are just talking to each other. We're chatting today, okay? So no seriousness, no, don't feel tensed, nothing. Because even I am not an expert in this. I'm also learning just like you all. So we are going to share each other's thoughts and then get on a little right track because of our experience. That's all. All right? Yeah. What do you think you all had carried back home yesterday, which is important for today's session? Anybody?
Communication.
Okay, one, yes. Absolutely.
The need for palliative care, ma'am. The need that a lot of people actually need this, but they're not aware about the care, because even I wasn't aware about this before I joined. So that I took.
Okay, very good. Yeah. Everything is important. I'm waiting for something that is going to strike me. So I'm waiting for some more answers. Yes. Just break your... What do you think that was very, very useful? And it was one of the closing remarks, if I'm not mistaken. I'm just giving you all small hints, okay? So it was one of the closing remarks which we told you all, which was important. Something that... I will go back to Jonathan. Okay, you said communication, yes. So I want you all to add to that. How would you communicate? What is it that you require? Is there something that you all were taught yesterday? I know you were taught. So I want you all to refresh your memories.
And the significance of rapport building in communication. And ma'am also said that it is okay to be silent when we have nothing else to say.
Right, right. So when you meet people, yes.
Yes. Every child is unique. They have some uniqueness with them, and they too need respect, and they too have dignity.
Absolutely, yes. Absolutely, yes. So if you have to break bad news, will you sit with a child and tell the child about it?
No, ma'am.
It's a unanimous no, right? Yeah. Because in India, it's a very different scenario how we have to go. Our rules are very different to the Western world. Okay, so let me try sharing today's. Okay, coming to that question, I want you all to just think about this word spikes. Yes? Was it taught to you all yesterday?
Yes.
Yeah, so just if you have your notebooks and you all have written that down, I want you all to keep it in front of you because that's the only thing that is going to help you in counseling, breaking bad news, in collusion, anything you do for anything. It doesn't have to be a disease. Even if you're sitting with your partner in your later years in life, if you know how to go about this, you will be able to take care of the situation where you will handle it very beautifully. All right. Yeah. So Clara, I'm going to try to share. And if it doesn't happen, well and good, then you are there. Yeah. Okay. So you all have today what we are going to be taking is breaking bad news and collusion, and why is it important? Okay. That's the question today. Why is it important? Can any of you all tell me before I go to the next slide, why do you think this is important, breaking bad news to them, or if a collusion happens? And what do you mean by collusion?
That's the point where they get to know about the problem, and that's the point where they could break. And the first break அப்படின்றது அந்த பாயிண்ட்ல தான் நடக்கும். ஸோ இட்ஸ் வைட்டல் டு அந்த நியூஸை வந்து லைக் ஒரு ஸ்லோ அண்ட் வித் கைண்ட்னஸ் ஓட கொண்டு போனாதான் they'll be able to take the news to the fullest. இல்லைன்னா they might break in the middle and then something might happen. So
Okay.
I don't know if it's right now.
No, there's nothing right, there's nothing wrong. Okay, that's why we are here today, because we want to understand. There's nothing wrong in what you've said, but you will understand this word collusion, because when we started to get into palliative care, we were also wondering what the hell is this collusion? You know, collusion, you think what it is and all. So today I will take you all through how and what it means from what we thought it would be. All right. This is the basic skills that you all require for counseling. Am I right? First and foremost, you start with rapport building, right? Then you give them a little bit of a time. Let them, get themselves together, because you all are totally new to them. So you all can see how it goes. Then you look at who's with them. Is there a person that you need to sit with them as well? Because remember, this is India. See, our whole scenario, what we are going to be talking, Western countries talk very differently because there the trend is different. But here, our whole thing is on the family, and I'm concentrating more on pediatric palliative care. All right. So I'm trying to tell you all, if we are sitting in a scenario where a parent is sitting there with her sister, her grandmother, or her mom, you have to take everybody into confidence, right? Because one person's question may not be another person's question. One person's doubt may not be another person's doubt. So first and foremost, sitting with them, building a rapport with them is so, so important. All right. And after that, you see what goes around. You will see each one's body language. Then you start with reflecting and paraphrasing with them. And actually, more for us as social workers, the more you'll learn to ask questions will be very, very helpful. Because the more we ask questions, we are not giving them a solution, neither are we giving them advice, right? So always try and get on the summarizing and questions and telling them, is this what you have told me? இதுதான் நீங்க சொன்னீங்களா? இதுதான் இப்போ நீங்க சொன்னது இதுதானா? நான் புரிஞ்சுக்கிறது கரெக்டா? All that you all can always ask, so that shows your interest in them. They too feel that you're there for them and that you all are actually with the case for them. That is the first trust that we need to build with them. That is our basic counseling that all of you all know, which you all only have to practice in time. With practical experience, you all will get somewhere. All right. Most people do not listen with the intent to understand. They listen with the intent to reply. They are either speaking or preparing to speak. This was said by Stephen R. Convey. Am I right? Absolutely right. Because so many of us, even today, when someone's talking, I immediately cut them short. But the minute I get into the counselor mode, there is something that changes, and I start listening. But that's not correct. In our day-to-day life, when our parents come and talk to us, we have to listen. Our brother and sister or a sibling. It's always good to actually listen than to prepare an answer even before we understand the whole question. Okay. So where listening plays, it's an art, the art of listening. And it can be practiced by any number of people in any role. As I've written there in my slide, it's not just for palliative care. Okay, so there are certain fields over here. And these are the maximum fields where actually we are interacting with people and patients. So that's why it's nursing, social work, medical profession, the police, the ambulance service. Yeah, okay. So that's how it goes. So listening is one of the effective counseling skill that we all have to practice. How do we listen? How do we actually get the skill going in us? We have to be genuine. As I said, if you don't understand, it's okay to ask the question again, ask them for more information. No harm at all. Do you all feel, any of your students, do you all feel shy, or do you all feel it's not right to ask them a question just because the person is emotional? Do you feel that? No. And if a person is crying, are you in a big hurry that you have to finish all your questions? No, right? So you can give the person time, be with them. There's no hurry. A counselor's job is the only job, not like doctors and nurses, where it is time. It is not, we don't have time management here. We have all the time in the world because that is our job. All over the world, I've noticed social workers are the only ones who can spend that kind of time, body and mind, okay? Because we are there for a purpose, and that's what we are all trained to be. Not just for counselors, for any job. Now I'll tell you a small sort of a scenario. Now you all are there as social workers, one of you all, somebody who might be taking up a job in the hospital. Okay, so I'm only going to bring in this listening skill over here for you. That's why I'm giving you this example. When you're there, a parent comes in, walks into the reception. So you are there at the reception area. And what would you do when you see a mother or a father with a child walk into the hospital? They are entering into the hospital for the first time and they are looking all around. Would you be looking at your phone, or would you actually pay attention to them coming in? Tell me.
Pay attention to them.
You have to. Because I have seen a lot of social workers in the hospitals I go, sometimes they're not looking around. So what happens when we enter in, we see some parents who feel that they're lost in that place, So we go tap the shoulder and we tell them, just go check out on that parent. This is the change we in Golden Butterflies want to bring in every hospital, A lot of them are doing their job, but they're doing it as a job. That is what all of y'all are going to change. It is not a job. Y'all are going to go there from your heart to help, to support, to give emotional support. Okay. So once that person comes in, your job is to understand them. If you don't know the language, hold them back, get somebody who knows the language, talk to them. What have you done in that instant for that parent? Please tell me. When you have met the parent, you have gone, met them, asked them what it is. So that few minutes of you just interacting with them, what have you made the parents feel?
Made them feel comfortable.
Absolutely. That for a person, especially coming from a different state with the language not known, and when they enter in, it is such a good feeling to know that there is somebody there for them. And that is, if you notice in all our Golden Butterflies, our first slogan is that only, saying that we are there for you. So that's a beautiful thing when you go there. You may not be able to help them at all. Let me tell you, we can't help everybody. But that minute they entered in, making them feel comfortable has actually brought a lot of their stress down. Okay. And then, of course, it goes further. Then try to be brief when reflecting back. Okay, the speaker should do most of the talking. So always reflecting back, listening to them, as I said, that shows how much of interest you're paying in their case. And use your own words. Please don't feel that if you've heard somebody's lecture, you need to use big terms, you need to use, no. Use and summarize and paraphrase in a very simple language, whatever the regional language may be, or English, in a way they understand. And ask them, have they understood what you have said? Sometimes what I say and what the way you understand can be two different things entirely. That means my communication is not right. Okay, so we have to. And always, this tone of ours is something that we all have to learn. It will be sometimes quite difficult when we see somebody coming in, a child is bleeding. All of us are limited. Oh my, it happens because we are human. But those are things where we become stronger, and we have to be able to accept what's there and not show to them by us the way we behave, our body language. Okay. Is it easy to sit and talk to children? Let me just turn it to sick children in the hospitals. I want to ask Akash and Vignesh, you all are going to the hospitals. How comfortable are you all? Are they there?
No, ma'am, they're not here. They told
Okay.
they'll join in a few minutes.
I saw Arokya joining in, so I thought he was there. Okay, no problem. Okay, tell me, the others who are here, have you all in your other community service, have you all interacted with children, students? Any of you have?
Not with sick children, but with children I've interacted.
Okay, okay. And what kind of interaction was yours, Jonathan?
They are. I worked at Don Bosco Convillum, so they didn't have family, so homeless children.
Okay.
So,
and how was your experience mingling with them? Were they open the minute you entered in? Were they all friendly?
no.
Yeah.
First, they are very reserved, and they observe us a lot. And after making, when they know that they are comfortable with us and நம்மகிட்ட சேஃபா ஃபீல் பண்ணாங்கன்னா அவங்கள கண்ட்ரோலே பண்ண முடியாது, நிறைய பேசிக்கிட்டே இருப்பாங்க.
Yes, absolutely right. That's a fact. They become such close buddies. They earlier interns of ours, they have become such a, what you call, they've got so used to them, and now even they know them by name and they miss them. It's just so beautiful the way the attachment comes. So it is not easy. So these are different wards. So when we go into the wards, we are mingling with a lot of different children and families. Each of the families' health issue of the child is different. The disease may be cancer, but where the cancer is in the body, that is also different. The pain what the child feels and the parents go through is also different. So each one is unique in their pain. So it's always, like if you've seen one case, it's not that you know all the cases. No, every case is different. So first and foremost, when you go to children, don't talk about the disease at all. Become a child, play with them, let them tell you, akka enakku inga novudukka, enna paachu, enna sonnanga. Then you turn to the mother, and don't talk many things in front of the child to the mother, because parents think the child doesn't understand. But let me tell you, the child understands. And the child feels when the mother or father are crying, the child feels, is it because of me? So it's always good that you take the parent a little aside, or you can tell them, நீங்க free இருந்தா வெளியில வரீங்களா, உங்களுக்கு பேச விருப்பம் இருக்குங்களா? It is nice for you all to ask them such questions. Or you can talk to them in general and then tell them, the child is here. When the child is sleeping, maybe I can come back and have a chat with you. Or give them the office number wherever you're working and say, you can contact me from this time to this time and we can have a chat. Okay, so it's not easy, but it's doable. So communication and counseling in a pediatric palliative care setting. So co-counseling skills. Can one of you all read what I've written? Mani, Molly?
Core counseling skills. Core listening skills are basic counseling skills or practice techniques that help the counselor to empathetically listen to the speaker. Skills include active listening, being aware of non-verbal communication, and building rapport.
Okay, so why have I underlined empathetically? Empathy plays a huge role. If you don't get into the other person's shoes to understand what they're going through, how can you help? Correct? So that is what I'm trying to touch here. And we have been talking about this a lot, so that's why I'm not going to go into detail on all this. All of you all are aware about the earlier thing, as I said, active listening, building rapport, all those things come into the basic thing for pediatric palliative care as well. It's not different. All right, any questions so far? Okay, so we are all on the same page. Done. What does this look like to each of you all? We are coming a little go. We're going into the core now. So tell me. This is, when you look at it, what do you feel? Like two of them fighting? Does it look like that to you all?
It's like doctors fighting over death, ma'am.
Yeah, exactly. It's about breaking bad news and collusion. The doctor's part of it is to say things to them, but the family's part of it is to say, no, I don't want to hear you. Don't tell everybody about it. A lot of things happen. Okay. So I just got a very beautiful picture when I was browsing yesterday. So I said, let me just put it up. It makes a lot of sense for breaking bad news and collusion from the hospital side and from the human part of it, you know. And this is why communication is vital in breaking bad news. They go through denial, and that's how the collusion comes in. They come out with very difficult questions, and then how emotional their reactions are and how we handle as social workers all these. All right. So what is collusion? Dennis, can you read that?
In healthcare, collusion implies withholding or not sharing among individuals involved any information about the diagnosis, prognosis, medical details about the person who is ill.
Yeah. Does that make sense to all of you?
Yes, ma'am.
It does. Okay. But when you face collusion and the family tells you, please don't tell my other members in the family. So what we mean by collusion is when there is a bad news to be said, okay, this is where you all have to pay attention. When there is a bad news to be broken to a family, what happens is now I have the mother and father. But do I know how strong the mother and father are? I don't know. I am only interacting most of the time with the mother. Okay, because the mother is the one who's allowed, and usually being a child, it's the mother usually who takes care of the child. The father does the running around, you know, getting the medicines. And in any ward, father and mother are not allowed to stay together. So what happens? The father is staying downstairs or staying in a room down or, you know, on the hallway, those kind of things. So what happens now? The doctors have decided, they have got all the news in their hands. And now the doctor has told the parent, but just put yourselves in that position. I'm sitting there and the doctor calls me and tells me that my child has got cancer. The child has got all these issues. And you know how a doctor speaks, okay? Because it's a doctor's duty to talk on a medical way. So the parent have listened to him. I mean, they're hearing him, but they're not actually paying any attention. They're not listening because it's all a shock to them, correct? There's a lot of, at that very moment, they are not going to accept it. Nothing is entering their system, frankly speaking, you know. And the doctor says, okay, the social worker will take you down, will take care of you all, will tell you all what next has to be done. The nurse is here and she will give you all the medication and she will guide you all. Both the father and mother come blank. Most cases, the father may have understood something, and what happens? The nurse is given a medical slip, so the father goes off to buy the medicines. Now, what happens to the mother? Do we know that she has family support? Have we asked her all these things? No, we haven't. Okay, so you see the mother seated over there. You go, you try talking to her, and she is going to ask you, okay, doctor said this to me. What will be your reply? Doctor told me my child has got cancer. What will be your reply? Samprita, I'm going to go with each of you. I want to ask, what will be your reply, Samprita?
In a soft way, I'll make her understand that's what it is, or I'll make sure she's not alone.
No, I just want one answer, okay? If she tells you my son has got cancer, the doctor told me my son has got cancer, what will be your answer? Difficult? Can't answer? Okay. Jayashree? I'm going to ask all of you. So be prepared to just give me an answer because this is our learning, okay?
Maybe I will tell her that I'm so sorry for what you have heard, and maybe I will give her some space.
Okay.
To analyze.
Okay. Rita?
I'll be telling her softly that it is, yes.
Okay.
The way she understands, and I'll make her to calm down.
Okay. Jonathan?
First, I'll calm her down and I'll try to understand what she thinks about that condition.
Okay. Mani?
Ma'am, actually, first of all, I'll be silent for some time, and that's all, ma'am. I don't know.
Okay. Okay. First and foremost, it is not easy. Okay. So you will go sit with the mother and you will just hold her hand. And if she's going to ask you a question, you don't know, right? The doctor didn't tell you about it. So how are we aware about anything? Correct? So you hold her hand and you just be with her. Yes. As Jonathan and somebody else said, be silent, Manimuli. First thing would be, yes, to go give her emotional support. All right. Then you ask her, do you have any family around with you? How many people know about your son's illness? All questions. Okay. Please remember, we are not here to give answers. We are only going to keep asking them questions. You know why? Because you can see on the screen, there will be a lot of barriers of communication here. So these are the barriers which you have to understand. Okay. Everything may not make sense to you what is on the screen, but some of it will. What happens is when you talk to certain parents, they actually don't tell their neighbors, they don't tell their family members that their son has got cancer. Because some of them have been asked to leave the house. Some owners don't want them in their house. So all these kind of things are there, which is still going on in society, you know, which is a very sad thing. So when they come and they tell us, "Yaarkum theriyaduma, na yaarkittume sollala." Okay. Here, the mother has accepted that word. She's bold enough. She has been listening to you. Very next minute, she might tell you, எங்க வீட்டுக்காருக்கு குழந்தது என்ன ப்ராப்பர் உள்ள இருக்க விஷயம் எங்க வீட்டுக்காருக்கு தெரியாது. அவர் எப்பயும் குடிச்சிட்டு கடுப்பார், அவருக்கு என்ன தெரிய போகுது? You get my point? So you have to ask her, what is it if she has a problem about not telling another person? Why she doesn't want to say it? What are the reasons she doesn't want to? You know, those are things which you have to actually ask her. It's very important to understand why they don't want to do it. Later, I will tell you why we need to tell them it is good if they can do it. Okay. They will have a lot of what they are going through. None of us can actually bear it. None of us can even think about it, you know, and it will be strange when they tell us, they might, the sibling may be there. They would have not told the sibling, because in school, if the sibling comes to know, it's a different ball game for the child. So a lot of problems each of the families go through. Some families are very open, they understand, and they come and tell us, நீங்க இத பத்தி கேட்டேன் கொஞ்சம் சொல்றீங்களா, பையன் கிட்ட மாத்திரம் சொல்லாதீங்க. That also they say, because it is for the parent to tell the child. And we have noticed children in our counseling that we've had children who are from 6 years above who actually understand what is a cancer ward. Remember, they're all in a huge ward. Every child is talking to one another. They're playing together. And somewhere they're all listening. And you know how we women are, especially like when we meet together, we all are a little verbal and we are talking loud. The child is hearing the word cancer. So the parent might think the child doesn't know, but the child does know, but it's not our duty to tell them. It's not our duty to talk to the child on all these things. Because today's collusion, what we're talking, it's only about the family's collusions. Okay, they might have their own issues, which we listen to, and we try to understand where we can help them. So here the research report, on psycho-oncology, disclosures against family or cultural beliefs. It causes emotional distress to patients. Patients would lose hope and their fighting spirit and can cause psychological and emotional distress. Is it right? It is, right? Yeah, because these are all things that can happen. Some child may be strong enough to bear it. Some child may not be able to bear it. And if the child has a sibling who's very attached to the brother or sister, can you imagine the trauma that child is going to go through? The emotional distress that child might go through? So there are a lot of things as social workers that we really actually need to gather before anything big falls onto the family. We have to be very careful on that. So every word we speak has to be very careful. So that's why we say silence is better, because we should not hurt the family already who's in distress. All right. Not required to inform elderly patients. Patients will be better off not knowing their true diagnosis. These are all the things that come under, for these, when it comes under collusion. But each of these, you will have to go in detail. That is why these are questions which you should ask. Now here we've put patients would lose hope and their fighting spirit. You can frame that as a question and ask the caregiver. ஏன் நீங்க இது வந்து சொல்லக்கூடாதுன்னு நினைக்கிறீங்க? ஏன் அவங்க வந்து அவங்களுக்கு இந்த வியாதி அவங்களுக்கு சக்தி இருக்காதா? I mean, you know Tamil better, so you can use those kind of words, So all these what I've given you, turn them into questions. These are the kind of questions which you will have to ask them, which will make it easier for you all to understand why they say, why there is a collusion, why they are not wanting you to talk to one another. Okay, and this is the high incidence of collusion that has been researched. Indians tend towards family embeddedness. That's a fact. Many of us have a lot of relatives. We have others like that. Our decision making is family centered. We cannot just, and especially when it is cancer, it is not easily taken by the family. Suddenly everybody is a doctor. Suddenly everybody knows everything. So it becomes very difficult, and the funny thing is you will have close-knit families. You will have suddenly an uncle coming and asking you, who has never seen you in the hospital. I mean, you have never seen him. And suddenly he'll come out of the way and say, na Akash anga tata, na Akash anga mama, yen paiyenukku enna aachu, yen parenukku enna aachu. When they come, do you reply to them immediately? What would be your answer when somebody whom you have not met from the family comes and talks to you? Each of you, tell me.
Maybe we can ask them to wait for some time till we get back to them. அவங்க parents கிட்ட பேசிட்டு அவங்க கிட்ட வர வரைக்கும் நம்ம வெயிட் பண்ண சொல்லலாம் அந்த ரிலேட்டிவ்.
Okay, that's one way.
Any communication is நாங்க அவங்க கிட்ட சொல்லி பேரண்ட்ஸ் கிட்ட சொல்லிரோம், நீங்க அவங்க கிட்ட இருந்து தெரிஞ்சுக்கோங்க அப்படின்ற மாதிரி சொல்லுவாங்க.
Okay, that's another way as well. Yeah. Jayashree, Mani, Molly. Think of you all in that situation and just tell me what would you immediately say. Now suddenly they come barge in and they tell you, என் குழந்தைக்கு இந்த மாதிரி ஆயிடுச்சுன்னு அவங்க சொன்னாங்க. It's a person you have not met. First and foremost, you all should not feel perturbed. Okay, don't get worried, don't get what you call, at that minute, don't get anxious. Oh my god, somebody has come in and what am I going to say? No, you all have to be composed, and you can actually start talking to them. Don't talk about the child, talk to them about them. நீங்க யார் சார், உங்க பேர் சொல்லுங்க, how are you related to them, what have the parents told you, can we go meet the parent, உங்களை யார் இங்க கூட்டிட்டு வந்தாங்க அவங்க பத்தி, and அவங்க கூட உட்கார்ந்து நம்ம பேசலாம் சார். Okay, so that way you're not hurting. Remember, relatives make a huge difference in the hospitals, I'm telling you, because the doctors will throw you all out because the doctors believe that you all can handle the show outside. That is how there will be peace inside the hospital. Okay, the relatives can cause havoc. You all have seen it in many hospitals where you all have gone. Suddenly you'll hear one noise in one corridor, and it'll be somebody who's maybe just a friend, or who's just heard, or who's a well-wisher, suddenly making a big hue and cry. So it's how you handle the situation there that will matter. Okay, so it is that you have to take that person also into consideration. Remember, he is also upset, he's also emotionally there for the child. It's his anxiety to know more, and there are some who want to know that they know better than the parents, so those kind of things are there. But it's how you as social workers deal with the situation at that time. So don't be anxious, it's be very calm. So when you are calm and composed, the person talking to you will automatically mirror that image. Let me tell you, it works. Okay, it definitely works. Because if when he is perturbed and you too, your body language, your eyes, your hand movements, when they change, the person in front of you is also going to get more agitated. But if you actually are calm, get him to calm down, you will see that person is much more easier to handle. Okay, yes. Now let's get into one role play. Tell me some case study which you all have gone through, which you all would like to talk to and talk about. And I'm going to use that as a role play with you all now. Yeah, who's coming up? How many of you all shared your case studies yesterday? Or rather, who didn't share the case study yesterday?
I didn't, ma'am.
You didn't?
I didn't share it. Yes,
okay, would you like to do that now, John?
Yes, ma'am.
Yeah.
I spoke with the caregiver of Tillai. ஸோ அவங்க இருக்கிற இடம் வந்து தேரி குடியிருப்பு, தூத்துக்குடி டிஸ்ட்ரிக்ட். கேர்கிவர் வந்து அம்மா கிட்ட தான் பேசினேன். ஹர் நேம் இஸ் லக்ஷ்மி அண்ட் ஹர் ஹஸ்பண்ட் நேம் இஸ் சிவபாலன். They are married for 20 years and they have three children. The eldest son is Sanjay, 17 years old, who just completed 12th standard. Second daughter Parvi, 13 years old, and Tillai is 10 years old. He is a child patient. He has blood cancer. He is fighting with blood cancer. அவங்க வந்து லக்ஷ்மி இஸ் நாட் ஒர்க்கிங். கல்யாணத்துக்கு அப்புறம் ஹஸ்பண்ட் வந்து நான் ஒர்க் பண்ணுறேன், நீ பண்ணாத சொல்லி வச்சுட்டாங்க. ஸோ பிஃபோர் மேரேஜ் ஷி வாஸ் ஒர்க்கிங் அண்ட் டொமஸ்டிக் ஒர்க்கராக தான் இருக்காங்க. அதுக்கப்புறம் அதை வச்சு அவங்க பிரதர்ஸை வந்து படிக்க வச்சாங்க. ஸோ அதனால லவ் மேரேஜ் பண்ணி கல்யாணம் பண்ணிக்கிட்டாங்க. பிகாஸ் ஆஃப் தட் லவ் மேரேஜ் அவங்க ஃபேமிலிக்கும் அவங்களுக்கும் இருக்க கனெக்ஷன் வந்து வீக் ஆயிடுச்சு, ஒதுக்கி வச்சுட்டாங்க. ஸோ ஃபேமிலி சப்போர்ட் அவ்வளோ இல்லை. ஸோ இது வந்து ஃபேமிலி பேக்ரவுண்ட். கொஞ்சம் ஒரு எயித் மந்த் ஆஃப் 2020 வந்து தில்லைக்கு உடம்பு சரியில்லாம போச்சு. ஹை ஃபீவர் இருந்துச்சு. அப்புறம் நைட்ல வந்து சடனா வயிறு வலி வந்துச்சு. டே டைம்ல ரொம்ப ஃபீவரிஷா இருந்துச்சு. இந்த நாள் கழிச்சு எல்லோ அண்ட் கிரீன் கலர் மார்க்ஸ் வந்து அவங்க ஸ்கின்ல அப்பியர் ஆக ஆரம்பிச்சுது. ஸோ அவங்க ஜாண்டிஸா இருக்குமோ சஸ்பெக்ட் பண்ணாங்க. பட் நாள் ஆக ஆக ரொம்ப சிவியர் ஆனதுனால they took him to சூர்யா ஹாஸ்பிட்டல் in தூத்துக்குடி, where the test showed that bloodல இன்ஃபெக்ஷன் இருக்கு, நீங்க திருநெல்வேலி கவர்மெண்ட் ஹாஸ்பிட்டல் கூட்டு போங்க அப்படின்னு சொன்னாங்க. ஸோ அங்கே போன பிறகு they said child has blood cancer, நீங்கள் இங்கே மெடிசன் இல்லை, நீங்கள் டூ டேஸ் அங்கே இருந்தாங்க. அதுக்கப்புறம் டேக் them to கோல்டன் பட்டர்ஃப்ளைஸ் அப்படின்னு சொன்னாங்க. ஸோ ஆஃப்டர் இங்கே வந்த பிறகு ரவிச்சந்திரன் அப்படின்ற வரதுக்கு முன்னாடி ரியாக்ஷன் வாஸ், நம்ம இந்த மாதிரி ஒரு கண்டிஷன் இருக்கப்போ அவங்க என்ன பண்ணு தெரியல, ஃபேமிலியாக பாய்சன் சாப்பிட்டு நம்ம இறந்துடலாம், சூசைட் பண்ணிடலாம் அப்படின்னு இருந்தாங்க. பட் அவங்க ஹஸ்பண்ட் வந்து இல்லை, ஒரு தடவை நம்ம போய் பார்க்கலாம் அப்படின்னு சொல்லிட்டு தி brought him to கோல்டன் பட்டர்ஃப்ளைஸ். இந்த ரவிச்சந்திரன் சார் கிட்ட பேசினாங்க. அவங்க ரொம்ப கம்ஃபர்டிங்காக பேசினாங்க. எனக்கு ரொம்ப பயமா இருந்துச்சு போகிறப்போ. அங்கே போன அப்புறம் எங்களோட பயம்லாம் கொஞ்சம் கொஞ்சமாக குறைஞ்சிது. ரொம்பவே ஹெல்ப் பண்ணாங்க. இதை பற்றி ரொம்ப வரி பண்ண தேவையில்லை, நிறைய ஹெல்ப் இருக்கு உங்களுக்காக அப்படின்னு சொன்னாங்க. அப்புறம் they gave us a lot of provisions, financially help பண்ணாங்க, மெடிக்கல் ஹெல்ப் நிறைய கொடுத்தாங்க.
Okay, I'll stop you there, Jonathan. Thank you. That's really wonderful. Thank you so much. Now I'm going to use Jonathan's case study. So Jonathan is going to be the patient because he has interviewed and he knows the patient. You're going to behave and act like the patient, Jonathan. Okay. And I'm going to ask Jayashree to do the counseling. You're going to be the counselor. Okay, Jayashree? Or anybody else wants to lift your hand up?
I'm going to be the patient or the caregiver.
You're going to be the patient. No, I'm sorry, the caregiver. Yeah. I mean, yes, sorry. Yeah. You're the caregiver of the child. Okay. Anybody wants to take up the role, or shall I put Jayashree to do the counseling role? Yeah, they're all very relieved to have you, Jayashree. So take up the first bat. So you are the counselor. Jonathan is going to come to you. And how are you going to talk to him? And how are you going to? He doesn't know. Jonathan, now you don't know that your son has got cancer. Okay. You are only going to meet her and talk to her about all the problems that you're seeing, what your son is going through, and the doctors have spoken about it and things like that. I want to know how Jayashree is going to be a counselor, how she is going to interact with you. Okay. So this is more on the counseling techniques, how you girls, how you all are going to talk to each other and how much you all can listen and understand. Okay. Yeah. Can you spotlight both of them, please? Okay, I think it's because I'm sharing, we can't do that. Okay, doesn't matter. Yeah. Go ahead, Jonathan.
I should start now?
Yes.
I don't know how to start.
Actually, I have a doubt.
Yeah.
Since the caregiver doesn't know that the child is infected with cancer, like, am I the one who should be breaking the news to them, or I should just talk to them?
No, I want to know how you're going to break the news to them. Okay, that word cancer, how you're going to tell them. That is what we are going to try today with everybody. Everyone's not going to escape. I'm going to be doing with all of them. Only then I go into breaking bad news. Okay. So I want to see how you all are going to do it beforehand. So Jonathan, just think that you're going into a hospital and you're meeting her. So you go and you say, Vanako madam, that you start off. Yeah.
வணக்கம் மேடம், நான் வந்து தூத்துக்குடியிலேருந்து ஒரு கிராமத்துலேருந்து வரேன். என் பிள்ளை ரொம்ப நாளாக உடம்பு சரியில்லாமல் போயிருக்கு. நைட்டெல்லாம் வயிறு வலின்னு சொல்லி அழுகுறான். ஸ்கின்னில் தோல்லாம் பார்த்தீங்கன்னா மஞ்சள் கலரில் இருக்குது, பச்சை கலரில் வருது. டாக்டர் எங்கள் ஊரில் இது கொண்டு போய் காமிச்சேன்னா என்னன்னே தெரியலன்னு சொன்னாங்க. இங்கே தான் வர சொன்னாங்க. எனக்கு என்னன்னே தெரியல மேடம்.
எவ்வளோ நாளா உங்களுக்கு இந்த பிரச்சனை இருக்கு? நீங்க எவ்வளவு நாளா அதை பார்த்துட்டு இருக்கீங்க இந்த சிம்டம்ஸ்லாம்?
இப்போதான் மேடம், ஒரு வாரமாக தான் நமக்கு இது அழுந்துட்டு இருக்கான். அதுக்கு முன்னாடி ஃபீவர் ஜுரம் இருந்துச்சு, ஆனால் இந்த அளவுக்கு வலிலாம் இல்லை. ஒரு வாரமாக தான் ரொம்ப அழுந்துட்டு இருக்கான். முன்னெல்லாம் ரொம்ப நல்லா விளையாடுவான், வீட்டில் எந்த பிரச்சனையும் இருக்காது. இப்போதான் வந்து இப்படி ரொம்ப கஷ்டப்படுறாங்க, என்ன பண்ணுறதுன்னே தெரியல.
நீங்க இதுக்கு முன்னாடி வேற ஏதாவது ஹாஸ்பிட்டல் போய் ஏதாச்சும் டெஸ்ட் ஏதாச்சும் எடுத்தீங்களா சார்?
Okay, I'm going to stop you all both here. I will be doing that so that you all, you don't go into a thing, so that you understand where I'm cutting you off. Okay, Jayashree, the minute Jonathan came in and he said he's from a village and all that, did you do rapport building? You went off straight to the disease. Okay. What do you call give importance to the person in front of you. Okay. Talk to him, ask him how is he doing. இதெல்லாம் கேட்கப்போ ரொம்ப கஷ்டமா இருக்கு, குழந்தைக்கு இதெல்லாம் உங்களுக்கு நைட்டு தூங்க முடியுதுங்களா? Those kind of queries have to come about the person. Okay, because we are not doctors, we are here for emotional support. That's our role as social workers. Okay, so that's where I'm going to. Now Jayashree is finished. Jamuna, you're going to become the counselor. Again, Jonathan is going to come to you.
Yes,
this is how we learn. Okay, children, this is how we learn actually. So don't feel bad, because if I'm not able to talk, then you won't be able to talk elsewhere. Now this is where we can have our understanding. So Jonathan's coming to you. Yes.
From first, ma'am.
Yeah.
வணக்கம்மா, நான் தூத்துக்குடி கிராமத்துலேருந்து வரேன். என் பிள்ளைக்கு என்னமோ ரொம்ப நாளாக ஒரு 2 வாரமா உடம்பு சரியில்லை, நைட்டெல்லாம் வயிறு வலின்னு சொல்றான், பகலெல்லாம் அப்படியே ரொம்ப காய்ச்சல் அடிக்குது, என்ன பண்றேனே தெரியல மேடம். நான் கொஞ்ச நாள் கூட நல்லா தான் விளையாடிட்டு இருந்தான், இப்போ என்னன்னு தெரியல, பச்சை கலர்ல இருக்கு, மஞ்சள் கலர்ல இருக்கு, எங்க ஊர்ல கொண்டு போய் காமிச்சா என்னன்னு தெரியலன்னு சொல்றாங்க, இங்க வர சொன்னாங்க, என்ன கொஞ்சம் என்னன்னு பாருங்க மேடம்.
வாங்க, முதல்ல உங்க பேர் என்னன்னு தெரிஞ்சுக்கலாமா முதல்ல?
என் பேரு சிவபாலன் மேடம்.
உங்க குழந்தை பேர் என்னது?
என் குழந்தை பேரு தில்லை.
Yeah, when now the minute he saw you, the minute he has met you, he's flowing because there's so much of worry in him. He is talking all about the child. So your first question will be what? Unga per. See, that's why I'm purposely stopping you all where how you all are going to do it. So when he said that, immediately it will be உங்க குழந்தை பேர் என்னப்பா, இது ரொம்ப கஷ்டமா இருக்கு, நீங்க what you're going through, it must be really difficult. Okay, இன்னும் கொஞ்சம் உங்க ஊர் பத்தியும் உங்க பத்தியும் தெரிஞ்சுக்கலாமா இதெல்லாம். And trying to tell him I'm trying to understand what you're going through. We never say I understand him. Say நீங்க என்ன கஷ்டத்துல இருக்கீங்க அதை நான் புரியறதுக்கு பார்க்கறேன். Okay, I mean in Tamil you all can say it in that way. Yeah, once again go back. Jonathan has told you all that. I'm not going to make him repeat, poor fellow.
Okay.
So, yeah, so he has stopped. இந்த மாதிரி மஞ்சளா எல்லாம் வந்துட்டு இருக்கு மேடம்.
வாங்கம்மா, முதல்ல உங்க பேர் என்ன நான் தெரிஞ்சுக்கலாமா ஃபர்ஸ்ட்? சாரி மேம்.
No problem, we'll redo it, don't worry. Yeah, that's what we are here for. Come on, start again. ரொம்ப கஷ்டமா இருக்கு மேடம், எனக்கு இந்த மாதிரி குழந்தையோ எல்லாம் இருக்கு, நீங்க சொல்லுங்க என்ன மேடம்.
நீங்க சொல்றதை கேட்கும்போது எனக்கு ரொம்ப கஷ்டமா இருக்கு. ஆனா sorry ma'am.
No sorries Kanna, just go ahead with the flow, don't worry, it will happen. Imagine if you have a patient, I mean you have a caregiver in front of you, you're not going to be wondering, oh my god, did I say right, did I say wrong, right? Yeah, so just go ahead, no problem.
நீங்க சொல்றதை கேட்கும்போது எனக்கு ரொம்ப கஷ்டமா இருக்கு. உங்க குழந்தையோட பேர் என்னன்னு தெரிஞ்சுக்கலாமா? So that என்ன அவங்கள பத்தி நான் நிறைய இன்ஃபர்மேஷன் உங்களுக்கு கொடுக்க முடியும். குழந்தை பேர்
10 வயசு ஆகுதுமா, அவன் பேரு தில்லை. இப்பதான் வந்து 4வது படிச்சுட்டு இருந்தான். அவனுக்கு ரொம்ப கொஞ்ச நாளா முடியல, நல்லா சுட்டித்தனமா விளையாடிக்கிட்டே இருப்பான், எல்லாரும் கூட நல்லா பேசுவான். ஆனா இப்பெல்லாம் அவனால ஏஞ்சிக்க கூட முடியல, அவன் படுத்துக்கிட்டே தான் இருக்கான், தூங்கிக்கிட்டே தான் இருக்கான். அவனுக்கு ரொம்ப உடம்பெல்லாம் கொதிக்குது, அவன்கிட்ட நாங்களால பேசக்கூட முடியல.
நீங்க எப்படி இருக்கீங்க? குழந்தை வந்து இவ்வளவு கஷ்டப்படுறத பார்த்து உங்களுக்கு எப்படி இருக்கு? நீங்க எப்படி ஃபீல் பண்றீங்க?
எனக்கு
great yeah, that's what. Nice, thank you Jonathan, we will stop there. Yeah, no, I'm more about the counselor's role we are in. Okay, so now you're going to play the counselor Jonathan, and Preeta is going to be the Preeta Alice, you're going to be the caregiver. All right?
Yes ma'am.
Yeah, so now your scenario is you've got your daughter, and you can change your name if you want, and you can say that you're coming in to, your report has gone in, your doctor has just told you to wait, the report will come and they will tell you what the diagnosis and what it is. Okay, so you're going to talk to Jonathan about having come to the hospital, met the doctors, met the nurses, and you're very anxious to know what the problem is. Got it? Yeah, so you can talk in any language which is comfortable to both of you.
Okay.
Yeah,
இந்த மாதிரி காலையில இருந்து குழந்தைக்கு உடம்பு சரியாம இருந்துச்சு, நான் குழந்தைய கூட்டிட்டு வந்திருக்கேன், டாக்டர்ஸ் எல்லாம் ஏதேதோ சொல்லவே மாட்டாங்க, காலையில இருந்து இங்கதான் வெயிட் பண்ணிட்டு இருக்கேன், இங்கேயும் அங்கேயும் போயிட்டு இருக்காங்க, ரிப்போர்ட் வருது வெயிட் பண்ணுங்கன்னு சொல்றாங்க, என்ன நடக்குது எனக்கு எதுவும் புரியல, கொஞ்சம் சொல்றீங்களா?
கவலைப்படாதீங்கம்மா, நம்ம என்னன்னு பார்க்கலாம். கொஞ்சம் உட்காருங்க, கொஞ்சம் தண்ணி குடிச்சிட்டு என்ன ஆச்சு இன்னைக்கு, நீங்க வந்ததுன்னு என்ன ஆச்சுன்னு கொஞ்சம் விவரமா சொன்னீங்கன்னா என்னால என்ன உதவி முடியுமோ அதை உங்களுக்கு நான் பண்றேன்.
குழந்தைக்கு ரொம்ப 2 நாளா உடம்பு சரியாமலே இருந்துட்டு, ஜுரம் வந்துட்டு, வயிற்று வலி, அப்புறம் வாமிட்லாம் இருந்துட்டு, அதனால நான் பக்கத்துல இருக்க ஒரு சின்ன ஹாஸ்பிட்டல்ல காட்டினோம், அவங்க வந்து எங்களால பார்க்க முடியாது, நீங்க பெரிய ஹாஸ்பிட்டலுக்கு கொண்டு போங்கன்னு சொல்லிட்டாங்க. இங்க வந்து நாங்க பெரிய ஹாஸ்பிட்டலுக்கு காட்டினோம், அவங்க என்ன சொன்னாங்க, இருங்க நாங்க கொஞ்சம் டெஸ்ட் எல்லாம் எடுக்க வேண்டியதா இருக்கு, நாங்க எடுத்துட்டு உங்களுக்கு சொல்றோம் அப்படின்னு சொன்னாங்க. டெஸ்ட்டும் எடுத்துட்டாங்க. பட் வெயிட் பண்ணுங்கன்னு தான் சொல்றாங்க தவிர என்ன அப்படின்றத சொல்ல மாட்றாங்க. எனக்கு ரொம்ப பதட்டமா இருக்கு.
நீங்க
அதனால என்ன நடக்குதுன்னு கொஞ்சம் சொல்றீங்களா?
நீங்க தனியா வந்திருக்கீங்களாம்மா, இல்ல உங்க கூட யாராச்சும் வந்திருக்காங்க? உங்க
இல்ல
கணவர்?
நான் மட்டும் தான் வந்திருக்கேன் குழந்தைய கூட்டிட்டு.
இப்போ இங்க இருந்து உங்க வீடு ரொம்ப தூரமா? நீங்க ரொம்ப டிராவல் பண்ணி வந்திருக்கீங்களா? உங்களுக்கு கிட்ட கையில காசு இருக்கா? உங்களுக்கு சாப்பிட மதியானம்?
Okay, I'm just going to stop here. Now what is happening, Jonathan? Starting was absolutely awesome. Okay, the way you got her to sit down, give her water, perfect. But now now immediate question what you think is, that means you're beating around the bush. You're asking her, does she have money? That's got no relevance to what she has come there for. Correct? Yeah, okay. So now it is for you to break the news that you have to use the word cancer. So are you going to tell her? How are you going to tell her that?
I would get the results first from her.
The report has come. Okay, you have got the report has come. The doctor's called you inside. He's given you the report and you have got the report in your hand. So how are you going to break the news to her?
டெஸ்ட் ரிசல்ட்ஸ்லாம் பார்த்தா உங்க மகனுக்கு கேன்சர் இருக்க மாதிரி தெரியுது. இது நிறைய பேருக்கு இந்த காலத்துல நிறைய பேருக்கு வர விஷயம்தான். இது நினைச்சு நீங்க பதற வேண்டாம். டாக்டர் வேற என்ன சொன்னாங்க உங்ககிட்ட இதை பத்தி?
Okay, great. We will stop here. I'm going to go back to the presentation. So you all will see what kind of questions you all should ask. You don't tell a person directly that it is cancer because you don't know how they're going to deal with it. That is where spikes come in. Make them comfortable. See whether they want to know. Are they willing to hear the news? Are they wanting to know more about it? All those things come under the spikes protocol. Very important. So you will give you all a guidance how to go about it. Okay. And if you all have doubts after that, let me know. Excellent. Big hand to all of you all. Good job. How was it? How was it being a counselor? All four of you all. Three of you all. Yes. So just sitting inside your house, you're feeling nervous. So just imagine how much different it will be when you're in front of the person. Okay, it will come. It will just change you all, and you all will be able to handle it. All right. So this is just a little more on how do you handle this collusion. Okay. So family says don't tell. Then acknowledge what is the family's concerns. Very, very important. Explain benefits of telling them. You have to tell them all that why they need to know and why the patient has a right to know. For us, sometimes the children are very small, but we have children who are 8 to 10 years and all that. It is nice for you to make the parents understand why they need to tell the child. Okay. And you can ask them, do they suspect? Do they think that there is any other, that they don't believe in this diagnosis? Then definitely ask them, how are they feeling when they hear this news? Okay. And explain possible harmful effects of not telling. That is also there, because the family may not understand all this at that particular time. They are all not thinking straight. So for us, it is gradually to make them understand why not to tell, what are you afraid of, and then acknowledge what they are afraid of. Okay. But it is their love and concern that they have for their loved ones. But you have to tell them, I can understand why you must be thinking this way. Okay. And you can then tell them what are the benefits of telling them, why it will help the patient. That is more important. And who are the families? Because sometimes, like for elders, they might want to write a will. They may want to discuss some other family matters. There might be a child who would want to, give away some toys to his siblings. It is difficult. But, it might be like, hey, na poite nada. Actually, children talk very nicely about death, to tell you the truth, because some of them, the way they come and they talk to us, நான் போயிட்டோன்னா அந்த ஒரு இது இருக்குல்ல, அது அம்மாக்கெல்லாம் தெரியாது. And the same thing when they talk, the child even can play around with death. To tell you, we had a child who came in and said, நான் எனக்கு ஏதாவது வேணும்னா அம்மா அப்பா கிட்ட சொல்லிடுவேன், நான் தான் செத்து போறேன்ல, அது வாங்கி கொடுங்க. See the psychology of the child. So child is not afraid to die. Child doesn't know what all that is. For it, it was just that it wants something and it's playing with the word death. But how much it hurts a parent, the child will not understand. So these are times when you counsel the parent. So, and the child is actually knowing, and I think one of the 2 cases is where the child, like, it's okay. At least I'm not having this pain. At the end of it, everywhere it's about pain. So that's where palliative care comes in, where we give them, relief from pain and quality of life, where the final thing comes in, where they play well, they eat well, they are happy, and they are happy to go peacefully. And the parents also don't see suffering. It's very difficult when we have family members in the hospital for a long time, and then we hear that they've suffered so much and then they've passed away, that it takes a toll on the whole family. It's the same thing with children, it's even more. So when a parent and the caregiver sees a child not actually suffering so much, and in comfort, to tell you, the parent sleeps better, the parent eats better, they are able to accept the child's condition. They are able to see the child is happy. That's all that they want, because they have seen so many years of suffering. So now they are so happy that, yes, the child is, it's not that they're happy the child is going to die, but they're happy that the child is not in pain. That is the most important question there. So these are things, if it is an elderly person, they might be wanting to finish their work. This is for palliative care for the adults. So these are simple things which the parent might also want to know, which makes them understand why it is good that anybody who's a patient, it's good that they know. And it's simple that they know what they are going through. We may not always win. You only fail if you stop trying. Yes or no? It is so correct. We should try our best. We should ask them, how has it made you feel not telling him? And they will give you a lot of answers. இல்ல அவனுக்கு முடியாது, அந்த குழந்தைக்கு தாங்குற சக்தி கிடையாது, உங்களுக்கு தெரியாதுங்க. ஆமாம்மா, கண்டிப்பா எனக்கு தெரியாது. ஆனா நீங்க எப்போ உனக்கு தோணுதோ, அந்த குழந்தைக்கு எப்போ தைரியம் இருக்குன்னு நினைக்கிறீங்களோ, அப்போ நீங்க சொல்றது நல்லது. நீங்க சொன்னா இதெல்லாம் அந்த குழந்தைக்கு ஏதாவது பண்ண விருப்பம் இருக்கும். உங்க கூட உங்களுக்கு இன்னும் கொஞ்சம் மெமரிஸ் அந்த குழந்தை கூட பண்ணறதுக்கு அந்த குழந்தைக்கு விருப்பம் இருக்கும். அந்த குழந்தைக்கு ஏதாவது ஒரு ஆசை இருக்கும். அதை நமக்கு we can fulfill those wishes of the child. So that is why I'm telling you, but always come back with a but. Say, ஆனா குழந்தைக்கு உங்களுக்கு தான் உங்க குழந்தைய நல்லாவே தெரியும். நீங்க என்ன நினைக்கிறீங்களோ அது பண்ணுங்க. எது கரெக்டா நினைக்கிறேன். ஆனா இதெல்லாம் நான் என் கடமை உங்களுக்கு சொல்லி கொடுக்கறதுக்கு. Okay? Because they may not think on all these lines, but later when they go back home, all what you have said, they may recollect. And then maybe after a week or so, they will, when they meet you again in the hospital or they call you up, they will tell you, thanks ma, நீ இது சொன்னது நான் பையன் கிட்ட சொல்லியிருக்கிறேன். இப்போ பையன் என்கிட்ட பேசிட்டு இருக்கிறான். Because we have 14-year-olds, we have 16-year-old children and all who are suffering. And they have a right to know. You can't tell, oh, குழந்தைக்கு சொன்னா இதாயிடும். But the parent knows better. At the end of it, please remember, in India, it is what the parents want. We have to go by their decision. Okay? And here we have this, I like this saying so much, try and fail, but never fail to try. Okay? Yeah. What is bad news? Jayashree, can you read that, please?
Situations where there is either a feeling of no hope, a threat to person's mental or physical well-being, risk of upsetting an established lifestyle, or where a message is given which conveys to an individual fewer choices in his or her life. 1990. Oh, sorry.
Yeah, that's okay. That's a person's name. That's
yeah. Any information which adversely and seriously affects an individual's view of his or her future. Buckman. Any information that is not welcome, Arbor and Gallagher. Yeah. An uncomfortable experience for both the giver and the receiver.
Yeah. It is a feeling of no hope. Correct? Bad news is in a situation when it is nothing good is coming out of that bad news. Okay? Why should it be done? Because better psychological adjustment by the patient. It reduces the stress in doctors. Correct? And it is not what you call, not just the doctors who feel the stress less, because every patient only wants to hear it from the doctor, which we have understood. How much ever we say, remember, doctor is God, and they prefer to hear it. So if we have prepared the patient, the caregiver well, it's much easier for the doctor also to deal with them. Okay, so this helps them to have open discussions with their relatives and empowers the patient. Okay, and why is it difficult? Because the patient's perspective is different. Patients often have vivid memories of receiving bad news. So you don't know, maybe somebody else in the family had cancer and they had a very bad experience. We don't know about it. So these are things which will come out when we talk to them, and then we tell them why this is happening. So for here, finally, when treating a child, no one usually confers with the parent or guardian before this. I mean, one usually confers. Okay, so this is where I was telling you, it's very important for us in pediatric palliative care. The family, the parent, the guardian is the boss. They are the ones who finally make the decision. Okay, and this is a very nice thing that Buckman in 1992 said. The task of breaking bad news. If we do it badly, the patient or family members may never forgive us. But if we do it well, they will never forget us. Yeah, so it is a thing. I took this from Professor Uttam Murli, and I was going through his thing on breaking bad news, and it is so much, it is not easy. It's really not easy. It takes a lot of practice. So I would always say it upsets even a social worker sometimes when we are trying to break bad news. You can go back feeling miserable the whole day. So these are things which you all have to have in clinical practice, where you have to go back and de-stress. Please remember, that's very, very important. Okay. As counselors, we have to be making sure that we are emotionally strong. There is any time that you all have had a situation, please go talk to your mentor or talk to another counselor who understands in the role that you all are playing anywhere. That's very important, students. I want you all to always, always remember that. Okay, because tomorrow you all should not become a burden at home. Your parents or in future, whoever you all are with, they should not, your home front should never become what you're working. You should be able to let go of your work. Once you get out of the hospital, you are no more a counselor. Okay, remember, you're a human being as well. So please, only that will take you all in the many more years to come. That is what will guide you. Otherwise, you can break. So I'm only helping you all that you all should not break. There are times when, in my own experience, when I know I've had a very heavy case, that whole week I will not take another case at all. Why? Because I need to recoup. I need to actually understand. I need to let go. My system is also tightened because of the case has been very heavy. All right. So we can't bring it back to the house. Then we are not doing we are not being a good counselor. Okay. Just remember that. Yeah. Done. So now for your next case study, which we are going to do, I want you all to have this in mind. Okay. Now I want you to go through this. This is the spikes protocol. Before you break bad news, even before you talk to a parent, for anything, when you meet them, this is a very good strategy which you can see. Okay, starting an interview, set the place, put the chairs next to each other, face to face, keep a very little distance. Of course, now with social distancing with us, you all just wear your masks on, and please make sure you're sanitized. But otherwise, no tables between a counselor and a counselee. Okay, please, no barriers. Make sure you all are sitting next to each other so that if there is a need of a comfort, you are there to, touch them or give them a hand or hold their hand. Then ask the patient, what all do they know? Okay, you have to understand what is it that they know and how much do they want to know. That will be your next question. And when they say, what do they know? You have to listen very, very carefully. What is it that they've actually understood? And after that, if they've said certain things to you that you know that they have understood that the child is sick, the child has got a disease, and after that, they really may not want to know anything further. So that is where you come asking them, how much do they want to know? Okay. Then, are you interested in hearing about this disease more? How much have you got information? Remember, they are talking to a lot of people. We are not the only ones with brains. They have more brains than us because they are the sufferers. So they will be going, talking to people. They will, go through internet. They will browse because they want to make sure the child gets all right. For them, that is their focus. So they will go to every pillar and post to see where they can get more information, how they can help their child. So please remember, always good to ask the caregiver how much they know, what is it that they want to know, and how much of the disease information that they know already and they want to know more. Am I making sense? Is it clear? Okay. Then you respond to the patient's or family's feeling. Okay, you see the emotions, you see how it is, and then you respond to that. If you feel they are not up to it, some of them can get hysterical. You may not be able to handle them. So what do you do at that time? Just don't tell them anything. Leave the matter. Because you first have to handle that person. No, they don't need to hear this news to make them even worse. So just leave it at that. Doesn't matter. They might come back the next day, or somebody else might tell them, or they will hear it from their own relatives or somebody who's heard about it. All right. Then you summarize and you plan the follow-up with them. This is your spikes protocol. I want you all to please get that into your, okay, I'm going to keep that on so that for the next case study, I have you all. Now your case study is with this protocol. Okay. So I'm going to give you all a case study about a child who's 10 years old, and the child has been brought to the hospital for blood cancer. The mother has no clue. She's from the village. She has no clue at all. She has no husband. She has her mother coming with her every time. And for her, she only knows that the child is losing weight. And every time she comes to the hospital, blood ஏத்த சொல்றாங்க. அது ஏன் ஏத்த சொல்றாங்க எனக்கு புரியல. எப்ப பார்த்தாலும் வந்தாலும் இல்லாட்டி அன்னைக்கு குழந்தைக்கு முடியல ரொம்ப சாப்பிடலன்னு சொல்லிட்டு blood ஏத்த மாட்டாங்கம்மா. அது என்னன்னு எனக்கு புரியல. Okay. So now this setting, how are you going to break the bad news to them? Okay. Samprita, where is she?
Yes, ma'am.
Yeah. Samprita, you want to be the counselor or the counselee or the caregiver?
I'll be the caregiver.
Okay. So Preeta, you'll be the counselor. Okay. Take a few minutes and then so Preeta, you will welcome the caregiver into your room. Say now you're in a room, you're waiting for her. So she's coming in. How are you going to set the place? Since we are online, forget the first part. But when we do it offline, we make you all do it, So we make you all pull up the chairs and things like that. So now you can start off. You can welcome her in and you can talk to her. The caregiver's name is Geeta.
Okay, ma'am. உள்ள வாங்க. உட்கார். கம்ஃபர்டபுளா இருக்கீங்களா? நீங்க உங்களை பத்தி கொஞ்சம் சொல்லுங்க. உங்க பேர் என்ன? எங்க இருந்து வரீங்க?
என் பேரு கீதாங்க. நான் ஏதோ பக்கத்துல இருக்கிற கிராமத்துல இருந்து வரேன். இந்த ஹாஸ்பிட்டலுக்கு தான் ரொம்ப நாளா வந்துட்டு இருக்கேன். ஆக்சுவலி பாப்பாக்கு உடம்பு சரியில்லை, அதுக்கு தான் வந்துட்டு இருக்கேன். பாப்பா வந்துட்டு இப்போ ரீசெண்டா ஃபுல்லா அவளோட வெயிட் எல்லாம் திடீர்னு ரொம்ப குறைஞ்சிட்டு வருது. நல்லாதான் இருப்பா, நல்லா விளையாடிட்டு ஜாலியா தான் இருப்பா, எல்லாரு கூடயும் நல்லா பழகுவா. இப்ப கொஞ்ச நாளாவே அவளுக்கு உடம்பு சரியில்லாம போகுது. வெயிட் வந்து திடீர்னு குறையுது, என்னன்னு தெரியல. ஒவ்வொரு வாட்டியும் ஹாஸ்பிட்டல் வரும்போது திடீர்னு ஏதோ ரத்தம் ஏத்து சொல்றாங்க, என்னன்னு என்கிட்ட ஒழுங்காவும் சொல்ல மாட்டாங்க. எனக்கு என்ன பண்றதுன்னே தெரியல.
உங்க கூட யார் வந்திருக்காங்க?
என் கூட இப்போ நான் தனியா தாங்க வந்திருக்கேன். இல்லன்னா எங்க அம்மா வருவாங்க என் கூட.
ஓகே. உங்களுக்கு வந்து பாப்பாக்கு வந்து பிளட் ஏத்த சொல்லிட்டு இருக்காங்க, வெயிட் குறைஞ்சிட்டு இருக்கு. சோ இத பத்தி நீங்க என்ன நினைக்கிறீங்க? உங்களுக்கு எப்படி இது ஃபீல் ஆகுது?
எனக்கு என்னங்க ஒரே கவலையா இருக்கு. என்னன்னு ஒழுங்கா தெரியவும் மாட்டேங்குது. யாரும் ஒழுங்கா எதுவும் சொல்ல மாட்டாங்க. என்னால எதுவுமே பண்ண முடியலன்னு ரொம்ப கஷ்டமா இருக்குங்க.
இதுக்கு முன்னாடியும் நீங்க வேற ஏதாச்சும் இடத்துல இத பத்தி கன்சல்ட் பண்ணீங்களா?
இல்லைங்க. ஃபர்ஸ்ட் ஒரு சின்ன ஹாஸ்பிட்டல் போனோம். அவங்க வந்து இங்க வர சொல்லியிருந்தாங்க. சரி இங்க வந்து எல்லாம் ஏதாவது சொல்லுவாங்கன்னு பார்த்தா எதுவுமே சொல்ல மாட்றாங்க. எனக்கு ஏதாவது தெரிஞ்சு நான் ஏதாவது பண்ணலான்னு பார்த்தா எனக்கு இத பத்தி எதுவும் தெரியவும் மாட்டேங்குது. பாப்பா வந்து முன்னாடி வந்து அவ்ளோ நல்லா சந்தோஷமா அப்படி இருந்தா, இப்போ திடீர்னு இந்த மாரி பலவீனமா ஆனது பார்க்கும்போது எனக்கு ரொம்ப கஷ்டமா இருக்கு.
ஓகே. ஸோ ஒன்றும் நீங்க பதட்டப்படாதீங்க. பாப்பாக்கு வந்து பிளட்ல கொஞ்சம் ப்ராப்ளம் இருக்கு. அதாச்சும் நீங்க ரொம்ப டென்ஷன் ஆகாதீங்க. கொஞ்சம் பொறுமையா நான் சொல்றது கேளுங்க. பாப்பாக்கு வந்து பிளட்ல வந்து ஒரு ஒரு நோய் இருக்கு. அ அத டாக்டர்ஸ் இன்னும் கொஞ்சம் டாக்டர்ஸ் கிட்ட நான் இன்னும் கொஞ்சம் கிளியரா அத பத்தின டீட்டெயில்ஸ் வாங்குவேன். நீங்க பதட்டப்படாதீங்க. தைரியமா இருங்க. எதுவா இருந்தாலும் ஃபேஸ் பண்ணலாம். ஸோ
Okay, let us stop
that's all,
there.
ma'am.
Very good. Yeah, no, good. Very good. Nice try. How many of you all feel they did an awesome job? Yeah, very nice. Yes, Preeta. The only thing over here is you can make out now your loss of words. You know, now you don't know what to tell her. So you're going on telling her, Padishtapadadinga. You've already told her that. By telling her 2-3 times, you are making her get anxious. You get my point? Okay. So how are you going to break the bad news to her? She already gave you information that she doesn't know anything. So your next question will be asking her, would you like to know more about this disease? Have you heard about the word cancer? Or you can say, have you heard about this, what one you all in Tamil, what do you all say? Dr. Noya?
புற்றுநோய்.
So you can ask her in Tamil that, you know, அதை பத்தி டாக்டருக்கு அவங்க கிட்ட பேசியிருக்கிறாங்களா, குழந்தைக்கு என்ன இருக்குன்னு சொல்லி இருக்கிறாங்களா. Even before you use the word, you can ask her, டாக்டர் இதை பத்தி என்ன உங்களுக்கு சொல்லியிருக்கிறாங்க, இந்த நோய் பத்தி ஏதாவது சொல்லியிருக்கிறாங்களா, குழந்தைக்கு என்ன இது. Ask her so that you get all the information what she knows. The second one, patient's perception, what do they know. Gather all that. Fully still she says she doesn't know anything, then you should say, நான் இப்போ உங்ககிட்ட சொல்றது வந்து உங்களுக்கு what you call, உங்களுக்கு how do I tell you in Tamil? In English I will have to, the way you would tell her is, you know, I'm going to tell you about your child's sickness. Are you ready to hear about it? Okay, y'all please do the translation in Tamil. This is how I would go. My Tamil comes to me automatically when I'm with a child, but now when I'm telling y'all, I'm not able to tell y'all. But this is how it is. Then you can, if she says, ஆமாமா எது இருந்தாலும் நான் தைரியமா ஏத்துக்கிற பலம் இருக்குங்களா. ஓகே, உங்க அம்மாவும் கூப்பிடுறதுக்கு உங்க அம்மாவும் இங்க உள்ள கூப்பிட்டு உங்க அம்மா உங்க கூட உட்கார வைக்கலாமா, உங்க அம்மா கூடயே நம்ம சொல்லலாமா. She says, இல்லைங்க நான் தைரியமா இருக்கிறேன் நான் சொல்றேன். Then you pull your chair, you go next to her, you sit next to her and you tell her, இந்த மாதிரி ஒரு வியாதி குழந்தைக்கு ரொம்ப நாளா இருக்கு, இதுதான் அவங்க வந்து சரி பண்ண பாக்குறாங்க. See, give them that little hope. Don't make that the child is, we don't know, the child might recover. Correct, the child might have come in at a time when with treatment it can recover. So parents, the minute they hear cancer, they think very bad, you know. So we have to bring them back and say, இந்த மாதிரி இருக்கு, ஆனா குணப்படுத்துறதுக்கு டாக்டருங்க ட்ரீட்மெண்ட் பண்ணிட்டு இருக்கிறாங்க. So what happens, if she's cancer has gone high and then you're bringing her back calmly down, saying that there is treatment happening, we hope the child is going to get better, this is what's happening. Then you give her what you know about it, you know, நல்ல குழந்தைக்கு என்னென்ன டாக்டர் சொல்றாங்களோ அந்த மாதிரி கேளுங்க, சாப்பாடு என்னென்ன கொடுக்கணும், you go about it. Okay, great job. Let's give them a big hand. Good job. Yeah, another 2 of you all for one more role. Another case study is the child is only say 6 months old. The father and mother are come from north. They don't know the language and they are trying to they have been in the hospital for almost 3 months. Now the parent doesn't know what is happening, though the doctor has actually called them and told them there is no more treatment. Okay, this is your case study. How are you going to break the bad news that the child is in palliative state? Okay, I want to know how you all are going to handle this. Okay, now let me see whom I can get in. Danis and Manimoli? Yes?
Yes, ma'am.
Okay. So what roles do you all want to play? Who wants to be the counselor?
Ma'am, one more time I need to, can you just tell me that the child is 6 months old?
Correct. The child is 6 months old. Okay. And the child has been in the hospital for more than 3 months.
Okay.
Okay. Has got cancer. See, the mother, everyone knows it's got cancer. Now I'm going into palliative state. That means the doctor has told them there's no more treatment. They have to go home. Okay. Because now there is, the child is very, very sick and the cancer has spread all over the body. So now they have to go home. So, so you're the caregiver.
Okay.
Manimoli, you're the caregiver. So, Danis, you're going to be the counselor.
Okay.
Okay. So how are you going to slowly bring it to her that there is no more treatment, there's only more care that has to be given to the child, and pain is what the child will go through. I'm just giving you some tips so that you can go on that. Yeah.
Ma'am, you said there's a language barrier as well.
Yes.
So how would I proceed?
I'm just telling you there's a language barrier. So now pretend that you know her language and you all are going to talk in the language. Okay.
So first I will make them sit down, ma'am.
Yeah, forget the first scene because we are on online. Forget the first scene. Yeah. So call her in, welcome her in, start like that. Yeah. Okay. Her the caregiver's name is, let's give it to her as Gayatri.
Good.
I'll do it in English, Manimali.
Okay. So I'm Manimuli, Emper Manimuli.
இல்லம்மா உங்க பேரு காயத்ரிமா.
Sorry, Gayatri.
Okay, Gayatri, tell me what you know. Tell me what the doctors have told you.
ஆக்சுவலி என்னோட 6 மந்த் என்னோட குழந்தைக்கு. ஸோ நாங்கள் வந்து ட்ரீட்மெண்ட்காக வந்திருந்தோம். அப்போ வந்து நாங்கள் அங்கே சொல்லும் போது பார்த்தா கேன்சர் வந்து உடம்பு ஃபுல்லாக ஸ்ப்ரெட் ஆயிடுச்சு, இனிமே காப்பாற்றவே முடியாது அந்த மாதிரி பேசிக்கிறாங்க.
ஓகே காயத்ரி,
கஷ்டமா இருக்குல்ல கேட்கும்போது.
புரியுது, கஷ்டம் இருக்கதான் செய்யும். ஆனா டாக்டர் வந்து எதுவும் பண்ண முடியாதுன்னு சொல்லியிருக்காங்க. ஆனா பிள்ளைக்கு நீங்க கேர் பண்றது நீங்க பண்ண முடியும் கன்ஃபார்மா. இப்ப ட்ரீட்மெண்ட் இல்லைன்னு சொன்னாலும் நீங்க விட வேண்டாம். ஏன்னா பிள்ளை சொல்ல முடியாது. பிள்ளைங்களுக்கு தமிழ்ல ரொம்ப வரல மேம்.
Stop. Okay. The second sentence, okay, forget the second sentence. When she came in, why were you not cordial? Why were you not cordial to her? You didn't even ask her how she's doing, from where she's coming, what is her background, how long has she been in the hospital. Okay. And the next sentence, there was one, the second one you said, what did you say? That it will be like that.
Meaning, I meant it like, now the doctors are saying that there's no treatment for now. But we don't know what might happen in the future, that there is still hope.
Before that, you said something very curt, that was not supportive. That was very curt. You were very straight to the point. No. You said, Sam, I'm not able to get that sentence. You said, Solupa? Yes, exactly. You can't say, Apida Nadukono, Apida Nadno. Then you're not being, what you call, you're not empathetic in this place. Okay, that was the thing. Yeah. So why, Mani, are you comfortable with English? Because I'd like her to do in English itself. Yeah. Now I'm going to restart the whole thing again, Danis. So from beginning, she's knocking at your door and you are welcoming Gayatri inside your door. So you as a counselor are the one who will be welcoming her, starting talking to her, and then she will talk to you. All right? Yeah. Knock, knock.
Excuse me, ma'am.
Please come in, Gayatri. Please sit down, ma'am.
Yeah. I'm Gayatri. I'm coming from Jaipur.
How are you?
Actually,
Okay.
yeah, I'm fine. So actually, for my baby is 6 months old. Me and my husband came before 3 months. We're having treatments for 3 months, and doctor said that they can't cure the disease because it is fully spreaded into her body.
I'm very sorry that you had to hear that from your doctor.
Yeah.
What should I say? I'm really stuck. I don't know what to say.
I'm really sorry to hear what you're going through with your child. Okay. The doctor's role, the doctor said what was the right, but it's her emotions. Counseling is always about feelings and emotions of the other person, Kana. That is what each of us have to understand. When anyone talks, look at them and see how they are feeling. That's all you have to look at. And that is what you need to talk about. I feel really sorry for what you're going through. How have you been managing so far? Who is here with you to help you? Have you had your breakfast today? Concern for them, because caregivers, many of them only look at the patient. I always believe that the patient has the doctor and nurse to take care of them, but who is there to take care of a caregiver? So we as counselors will have to be there to give them that support. And they don't need us 24/7. That 5 minutes or half an hour that I am spending with them, or you are going to talk to them, that's all that's going to matter a lot for them, because they say, oh my God, yaro enak anbu kodutanga ineki. That happiness will come in. All right. So that's all you have to do. Then you go into the next step. Okay, I will put Jonathan, you take up the counselor's role. Let us help one another here. Okay. Manimoli, I want you to wait. Okay, Tamil or English, both of you can talk whichever the language, that's all right. But I want the counselor to do their job first, Kana. So you just wait till they ask you to talk, all right?
Okay.
Knock, knock.
What do I say?
Gayatri, her name is Gayatri. Vanga Gayatri, ulla vanga.
வாங்க காயத்ரி, உள்ள உட்காருங்க.
One second. Usually in hospitals, no, we don't call them by their name, no. Vangama, ulla ukarungama. That's how we do. So exactly the same thing.
வாங்கம்மா,
சொல்லுங்கம்மா.
சொல்லுங்க.
என் பேர் காயத்ரி. நாங்க வந்து ஜெய்ப்பூர்ல இருந்தோம். இப்போ என்னோட குழந்தையோட ட்ரீட்மெண்ட்காக இங்க வந்திருக்கோம். Ma'am, 1 second, ma'am. First, he should speak or...
Yeah, I see, usually because you are enacting a role, what's happened is, because I've given you a case study, you're all ready with it, okay? But for a caregiver, when they come in, they will not talk. The caregiver will wait. The counselor has to, coax them, talk to them, make them feel comfortable, make them trust the person. The counselor has to be trusted. Only then. So I'm actually trying to get the role of the counselor here. So I want Jonathan to do more talking. Then after that, when he comes to you, then you break down with all your yes. Okay. Yeah. Shall we go ahead again from the beginning?
Yes, ma'am.
Yeah.
வாங்கம்மா, உட்காருங்கம்மா. ரொம்ப பதபதப்பா இருக்கீங்க. உணவு சாப்பிட்டீங்களா? எப்படி இருக்கீங்க நீங்க?
சாப்பிட்டேன், ஆனா கொஞ்சம் ஒரு மாதிரி ரொம்ப ஃபைன்லாம் சொல்ல முடியாது.
என்னாச்சுமா? ஏன் அப்படி சொல்றீங்க?
இல்ல, குழந்தைக்கு ட்ரீட்மெண்ட்காக ஜெய்ப்பூர்ல இருந்து வந்திருந்தோம். கொஞ்சம் மாசமாவே நாங்க ட்ரீட்மெண்ட் பண்ணிட்டு தான் இருக்கோம். பட் வந்து அத நினைச்சுதான் எனக்கு கொஞ்சம் கஷ்டமா இருக்கு. பிகாஸ் இப்போ நானும் ஹஸ்பண்டும் தான் அங்கிருந்து வந்திருக்கோம். அங்க ட்ரீட்மெண்ட் பண்ண முடியாதுன்னு சொல்லிட்டு தான் சரி இன்னும் பெரிய இடத்துக்கு போலான்ட்டு சென்னைக்கு நாங்க வந்திருந்தோம். இப்போ அந்த நாங்க ட்ரீட்மெண்ட் பண்ணிட்டு இருக்கும் போது சொன்னது என்னன்னா, குழந்தைக்கு வந்து கேன்சர் வந்து ரொம்ப உடம்பு ஃபுல்லா ஸ்ப்ரெட் ஆயிடுச்சுன்னு சொல்லிட்டாங்க. ஸோ அது ஒரு மாதிரி எங்களுக்கு ரொம்ப கஷ்டமா இருந்துச்சு.
புரியுதுமா, உங்க கஷ்டம் எனக்கு புரியுது. இந்த நிலைமையில யார் இருந்தாலும் இந்த மாதிரி தான் ஃபேஸ் பண்ணுவாங்கன்னு எனக்கு புரியுது. ட்ரீட்மெண்ட் கொடுத்தாங்கன்னு சொல்லிட்டீங்க. ட்ரீட்மெண்ட் எந்த நிலையில இருக்கு இப்போ? என்ன சொல்றாங்க டாக்டர்? கரெக்டா
இப்போ கரெக்டா என்ன சொல்றாங்கன்னா வந்து, ஃபர்ஸ்ட் நாங்க வந்து கொஞ்சம் லேட்டா ஆயிடுச்சுன்னு நினைக்கிறேன். நாங்க அதை கண்டுபிடிக்க வந்து ஹாஸ்பிட்டல்ல போனப்பவே அவங்க சொல்லிட்டாங்க இது வந்து 4th ஸ்டேஜ் அந்த மாதிரி சொல்லிட்டாங்க. அதுக்கப்புறம் ஃபுல்லா கேன்சர் வந்து ஃபுல்லா உடம்பு ஃபுல்லா வேற ஸ்ப்ரெட் ஆயிடுச்சுன்னு சொல்லிட்டாங்க. ஸோ அதுக்கு மேல எங்களுக்கு என்ன பண்றதுன்னு வேற தெரியல. இப்போ ரொம்ப ஒரு மாதிரி கஷ்டமா இருக்கு. எனக்கு ஹெல்ப் பண்ணிக்கோங்க, என்ன பண்றதுன்னு தெரியல.
கவலைப்படாதீங்கம்மா, நீங்க கரெக்டான இடத்துல தான் இருக்கிறீங்க. எந்த நிலையும் வந்து கடைசி அப்படின்னு சொல்ல முடியாது. கண்டிப்பா அது எந்த சுச்சுவேஷன் ஒர்ஸ்டா இருந்தாலும் அதுல வந்து நம்மளால என்ன நல்ல பெட்டரா பண்ண முடியும் அப்படின்னு நம்ம பார்க்கலாம். இந்த நிலைமையில இருந்து உங்களுக்கு சப்போர்ட் பண்ண நிறைய உதவி இருக்கு இந்த இடத்துல. உங்களுக்கு பொறுமையா என்னென்ன வேணும் அப்படிங்கறத நான் கண்டிப்பா உங்களுக்கு ஹெல்ப் பண்ண முடியும் எனக்கு தோணுது.
One sec, I'm going to stop you here. Correct. You've just said that before you go to that second sentence, இங்க இருக்கிறதெல்லாம் எங்களுக்கு ஹெல்ப் பண்ண முடியுமோ, இங்க நீங்க கரெக்டான இடத்துல இருக்கு. இது இந்த என்னென்ன உதவி நாங்க பண்ணுவோம்னு அது கேட்கறதுக்கு உங்களுக்கு விருப்பம் இருக்கா? அது இன்ட்ரெஸ்டட் ஃபர்ஸ்ட் ஆஃப் ஆல். ஓகே, யா, கோ அஹெட்.
நீங்க கரெக்டான இடத்துல தான் இருக்கிறீங்க. எங்களால என்ன உதவி பண்ண முடியும்ன்றது எங்களுக்கு தெரியும். உங்களுக்கு அதுல விருப்பம் இருக்குதா? இந்த இடத்துல நாங்க என்ன உதவி கொடுத்தாலும் உங்களால ஏத்துக்க முடியுமா?
கண்டிப்பா என்னால ஏத்துக்க முடியும். இதுக்கு மேல நீங்க என்ன உதவிக்கு வேண்டிதான் நாங்க வந்திருக்கோம். இதுக்கு மேல என்ன உதவி கிடைச்சாலும் கண்டிப்பா நாங்க இது பண்ணுவோம்.
What will you say after that? Okay, the way you put it is that I have all it. Are you? Will you take it? I think in Tamil that's how it goes. Will you take it? No, we are not demanding. You should. What you say is, you've come at the right place. You are at the right place where we can actually help you. But are you willing to hear more about how we can help you? Would you like to know how we can help you? Would you like to bring in your husband here so that we can talk to both of you together? So what have you understood? Now you have told me that the doctor has said it has spread everywhere. So what has the doctor told you? What is the final thing? What does the doctor feel? Can they continue treatment? Or what have they asked you? So ask her more questions. She says, illa ipo veetukku dhaan po solli irukkranga. Then you say, ஆமாம்மா இந்த மாதிரி கேஸுங்களுக்கு வந்து இந்த மாதிரி குழந்தைங்கள. So you're going to tell her that she's not the only one with a child like that. வேற குழந்தைங்கள, நாட் ரொம்ப குழந்தைங்க. டோன்ட் மேக் இட் லைக் ஆல் சில்ட்ரன் சஃபர். கொஞ்சம் எங்க கிட்ட வந்திருக்க 1-2 குழந்தைங்களுக்கு இந்த மாதிரி நடந்திருக்கு, எனக்கு ரொம்ப ரொம்ப கஷ்டம், உங்க குழந்தைக்கு இது வந்திருக்குது. You know, we are going back to giving them to understand that we are with them in their emotional time. You know, and we are really sorry what she's going through. That is how your phrasing should come. Always bringing it back, telling them, எனக்கு புரியுது, நான் உங்க கஷ்டம் இப்போ ரொம்ப ரொம்ப, I mean, in English, as I told you, it's easier to tell them, we are there with you, you know, and we understand what you're going through. At all given times, you need to tell them that, you know, we are here, we have a few children, we have seen such cases, and now when the doctor has said there is no more treatment, have you heard a word where they can help children to keep them comfortable? Don't bring the word palliative, everyone may not know. Okay, so you can use it like this. குழந்தைங்களுக்கு வந்து ட்ரீட்மெண்ட் இல்லாத கூட நம்மள அவங்கள வந்து சந்தோஷமா வச்சுக்கலாம். ஏன் சொல்லுங்க, you ask them again. Then say, இல்லப்பா வீட்டுக்கு போயிட்ட அப்புறம் இந்த மாதிரி ரொம்ப நோவு இருக்கும் குழந்தைங்களுக்கு, அப்ப நாங்க ஓடி ஓடி வந்துட்டு இருக்கணும். That is where you give them clarity. இப்போ குழந்தைக்கு இந்த மாதிரி ட்ரீட்மெண்ட் இல்லைன்னா நீங்க பணம் செலவு பண்ணி இந்த மாதிரி வராதிங்க. இந்த மாதிரி அவங்களுக்கு இந்த மாதிரி ஸ்தாபனங்க இருக்கு. நான் உங்களுக்கு சொல்றேன், உங்க குழந்தைக்கு வந்து நோவுக்கு மாத்திரம் தான் மருந்து இப்போ தேவை. வேற யார் என்ன வேணாலும் சொன்னாலும் நீங்க அதை ப்ளீஸ் ஏத்துக்காதீங்க. பட் யூ ஹாவ் டு see, இது நான் சொல்றது உங்களுக்கு புரியுதுங்களா? எவ்ரி டைம் யூ சே அ சென்டென்ஸ், go back, rephrase, ask them have they understood it. Okay, because sometimes they are only hearing you, they are only listening to you, but they're not actually paying attention. Because you remember, it is a shocking news that they've heard, it's all going over their head, and suddenly we are telling them, you know, the child is not going to have treatment, but we are going to keep the child happy. It's a big question mark. இது எப்படி ட்ரீட்மெண்ட் இல்லாத எப்படி குழந்தை நல்லா இருக்கும்? You know, it's a normal thing for people to understand. Because we are here, we know. Then you can tell them, உங்களுக்கு மாத்திரை மருந்து எங்க இருந்து கிடைக்கணும் அதெல்லாம் நான் பார்த்து உங்களுக்கு எழுதி கொடுக்குறேன். நீங்க எந்த ஊருக்கு போறீங்களோ அந்த இடத்துல ஒரு டாக்டர். So you should have your information correct in your hand. If you don't know, you should say, உங்க நம்பர் எங்க கிட்ட கொடுத்துட்டு போங்க, என்னென்ன உதவி உங்களுக்கு பண்ண முடியுமோ நான் எல்லாம் உங்களை கூப்பிட்டு நான் சொல்றேன். In case you are not clear about it. Okay, Dennis, you can understand what I'm saying, Dennis? Yeah. So this is how it will go. Okay. Do you like to take it the last bit one more time? Would you like to do that? Yeah. Manimuli, you start with like doctor இதுக்கு மேல எந்த ட்ரீட்மெண்ட்டும் இல்லைன்னு சொல்லிட்டாங்க, எல்லா இடத்துலயும் ஸ்ப்ரெட் ஆயிருக்கு.
இதுக்கு மேல எந்த ட்ரீட்மெண்ட்டும் இல்லைன்னு டாக்டர் சொல்லிட்டாங்க, உடம்பு ஃபுல்லா ஸ்ப்ரெட் ஆயிடுச்சுன்னு சொல்லிட்டாங்க. எங்களுக்கு இதுக்கு மேல என்ன பண்றதுன்னே தெரியல, ரொம்ப கஷ்டமா இருக்கு.
நீங்க கரெக்டான இடத்துக்கு தான் வந்திருக்கீங்கம்மா. எங்களால என்ன உதவி முடியும்ன்றது எங்களுக்கு தெரியும். நாங்க கண்டிப்பா உங்களுக்கு உதவ முடியும்னு எனக்கு தெரியும். இதை பற்றி உங்க கணவர் இருந்தாங்கன்னா நம்ம அதை பத்தி விவரமா சொல்லலாம். நீங்க அதுக்கு முன்னாடி உங்ககிட்ட டாக்டர் என்ன சொல்லியிருக்காங்க ட்ரீட்மெண்ட் பத்தி, உங்க குழந்தையோட நிலையை பத்தி என்ன சொன்னாங்க நீங்க சொன்னீங்கன்னா அதை பேஸ் பண்ணி உங்களுக்கு நான் உதவ எனக்கு ஹெல்ப்ஃபுல்லா இருக்கும்.
அதுதான் என்ன சொன்னாங்கன்னா, ஃபர்ஸ்ட் உடம்பு ஃபுல்லா இதுக்கு இப்போ ஸ்ப்ரெட் ஆயிடுச்சு, இவ்வளவு நாள் நாங்க லேட்டா தான் டயக்னோஸ் கேன்சர் இருக்குன்னு தெரிஞ்சதால வந்து கொஞ்சம் லாஸ்ட் ஸ்டேஜ் கிட்ட போயிட்டதால உடம்பெல்லாம் பரவிடுச்சு, இதுக்கு மேல எதுவும் இப்ப எதுவுமே ட்ரீட்மெண்ட் இதுக்கு மேல எதுவும் பண்ண முடியாது அப்படின்னு சொன்னாங்க.
இது நீங்க மட்டும் இது முதல் தடவை உங்களுக்கு தான் வருது அப்படின்னு வந்து நீங்க கவலைப்பட வேண்டாம். இந்த மாதிரி சில குழந்தைங்களும் வந்திருக்காங்க. இந்த மாதிரி இருக்கிறது இயல்பு தான், அது நேச்சுரல் தான். ட்ரீட்மெண்ட் அப்படின்றது அது மட்டும்.
Sorry, I'm going to cut you here. No, it is not natural. Don't say a word like that. It is not natural. Okay, so we have to only on emotional front. இங்க குழந்தைங்க வந்து இருக்கிறாங்க, இது நேச்சுரல் தான். நோ, உங்க குழந்தைக்கு என்ன நீங்க சஃபர் பண்ணீங்க, ரொம்ப கஷ்டமா இருக்கு. இதே மாதிரி குழந்தைங்க 1-2 எங்க மூலியமா நாங்க ஹெல்ப் பண்ணியிருக்கிறோம். See the way you say, it's the words, how you don't tweak it but don't twist it. The words that you say, that is only important. Okay, the way you say it to them. Okay, you all will get there. But great, the way you all are going into it, it is really nice. And then the last part of it, what you all have done, I'm not continuing here because you have got the gist of it. Okay, got it, Manimoli? You are able to understand the others?
Yes.
Prem was good?
Yes, ma'am.
Yeah, great. So it is not easy. Was it easy, Jonathan?
No, ma'am. One thing is because we are talking here, if it was real life, if I'm encountering with a caregiver, it would have been effective, but I'm kind of conscious when I'm talking.
Yeah. And it is what you call it, the comfort zone is not there because we are not done cases like this, no? Mm-hmm. So what happens is, even tomorrow you get a case, please remember in your mind, what you said was not right or wrong, because what you have said is said and done with. You can't take those words back, correct? So only for that, I make you all practice more and more. I would love you all can have these role plays even among your own selves. Okay, you all can take videos, you can send it to us, and then we can correct it for you all and tell you all where you all can talk a little better. It's all about communication. It's about how you actually communicate with one another. All right, great. Hats off to you all. Good job. Okay, yeah, the last part would be like basically telling the caregiver that if you call me, we have options where the child will be living in pain free. That is what you have to give them, that confidence before we send them home for palliative care. You can tell them the child will be happy. We can continue keeping the child well by taking care of the pain medication, and we will help you with that pain medication. You just have to be in touch with us and make sure you give good nutrition to the child. And before they leave, always tell the caregiver, please don't forget to take care of yourself too. Okay, that's very important. Yeah. Okay, before we close, I just want to give you all these few phrases that you all have to avoid. Okay, do Google up breaking bad news. You all will get so many more different ways how you all can, what you should say, what you should not say. But these are things which I felt was very timely for us wherever we go. And you don't say things like that to them. What do you want us to do? You don't sit with a caregiver and say, okay, doctor, இப்படி சொல்லிட்டாங்க, இப்போ நாங்க என்னமா பண்ணோம், இதுக்கு நாங்க என்ன பண்ண முடியும்னு நினைக்கிறீங்க? No. இப்பதான் டாக்டர் சொல்லிட்டாங்க இல்ல உங்களுக்கு, இப்ப வீட்டுக்கு கூட்டிட்டு போயிட்டே இருங்களேன், இதுக்கு மேல ஒன்னும் பண்ண முடியாது. We can't say things like that. Not withdrawal call. Stop the machine, pull the plug. There's nothing more we can do. You might be in a very bad mood that day, and just because the patient comes in, and they don't use them as the punching bag. They are already suffering. Let us not make them suffer worse. If you can't help them, walk away from the scene and put another person to go take care of them. I always say that to all our volunteers and social workers. If you are not comfortable in that particular scenario, please excuse yourself. Don't walk away abruptly. Excuse yourself. Tell them that you're going to send another person to come and talk to them, and then go from the scene. Okay? You all have got these phrases down? Yeah. This is my final quote, which is so true. Nothing travels faster than the speed of light, with the possible exception of bad news, which obeys its own special law. Douglas Adams. It's a very, what you call, apt thing that he says. So let us see how we can better ourselves. Okay. And take it forward in the best way possible. I hope I didn't bore you all up. Okay, let me have all of you all an unmute. Thank you all for bearing with me. It is not easy, and but I think more and more you all do it among yourselves. You all will learn, because practice makes perfect. Okay. Yeah. Questions? I can see all smiles. I'm waiting for some question. Okay, tell me how you felt of the session today. What was it? Give me just 2 points, one positive point, one negative point of the session today. Each of you. Let me start with Jamuna.
Ma'am, breaking bad news, I could initially I could understand it's a big task, like it's a very responsible task to do actually, but I didn't know it had like இவ்ளோ விஷயம் இதுக்குள்ள இருக்கு அப்படின்றது I didn't know. And இப்போ அந்த ரோல் பிளே பண்ணும்போது I can understand, I could clearly picture myself அங்க இருந்து எனக்கு முன்னாடியே கேர்கிவர் இருக்கும்போது லைக் அவங்க பேசும்போது I can picture அவங்க என்ன go through பண்றாங்க with the scenario, but it's just that because of the lack of practice, I mean இத பத்தி knowledge இல்லாதனால I couldn't do good, but this is not just for the palliative care க்கு மட்டும் இல்ல அப்படின்றது எனக்கு தெரியுது, because everyone goes through a lot of problems in their own life. So it's vital to be very compassionate and kind to each other, and அசஸ் பண்ணும்போது கொஞ்சம் கேர்ஃபுல்லாவும் ஹர்ட் பண்ணாத அளவுக்கு இருந்து போகணும் அப்படின்றத I can understand.
Yeah, great. Dennis.
And first of all, breaking bad news, when I thought I was thinking that it was very important, because as a social worker, this is supposed to be common for us as well. And I thought I will be fine, but in reality, I was not. So that actually helped me a lot. The way that my perception also, it changed me, how I think and how I have to be. It taught me a lot.
Great. Jonathan.
I only have positives, no negatives.
Okay.
2 points. First one, I was very nervous before doing the role play. I had one role play activity at the Keepok Mental Hospital. I was interacting with one person, and he made me do a role play. He didn't teach me anything, but he made me do the role play. அதுக்கப்புறம் கமெண்ட்ஸ் சொன்னாங்க. ஸோ இங்கே நான் எப்படி பண்ண போறேன், தப்பா பண்ணிட்டு ரொம்ப இதுவாக இருந்துச்சு. பட் நான் நிறைய பேசுனதுல வந்து எனக்கே கொஞ்சம் ஆச்சரியமாச்சு. And it was useful because you told us how to speak and we corrected it in the next thing. So that was one positive. Second thing is அந்த collusionல பேஷண்ட் கிட்ட நம்ம சொல்றது அப்படின்னு வந்து I was able to relate. எனக்கு ஆக்சிடென்ட் ஆகும்போது ரொம்ப சீரியஸான கண்டிஷன். மை மதர் இஸ் வெரி வீக். ஸோ அவங்க கிட்ட டாக்டர் வந்து சொல்லலை, அப்பா கிட்ட தான் சொன்னாங்க. அப்பா வந்து அம்மா கிட்ட சொன்னாங்க, என்கிட்ட சொல்லவே இல்லை. சர்ஜரிக்கு முன்னாடி they didn't tell me anything. I had some 8 to 9 fractures in my face. So அப்போ I was like, எனக்கு தெரியும் என்ன நடக்குது அப்படின்றது தெரியும், பட் they are not telling what is there. அது வந்து பட் நான் அவங்கள வந்து அழ வைக்க கூடாது, நான் வந்து கான்ஃபிடென்ட்டா இருக்கணும், நான் ஸ்ட்ராங்கா இருந்தேன். அந்த வே த டாக்டர் ஸ்போக் வித் மீ. ஒரு டாக்டர் வந்து ரொம்ப ஃபேஸ்ல அடிச்ச மாதிரி ஒன்றும் கால் பண்ணாதீங்க, அது பண்ணிடலாம் சொன்னாங்க. இன்னொருத்தர் வந்து என் ஃபேஸ் அடிபட்டு ரத்தம் வருது, எம்பத்தட்டிக்கா வந்து ஃபேஸ் நல்லா இருக்கு, நேத்தோட நீங்க நல்லா இருக்கு, கொஞ்சம் பாசிட்டிவா பேசினாங்க. அப்புறம் எங்க அப்பா அம்மா கிட்ட அதெல்லாம் சரி பண்ணிடலாம்ப்பா அப்படி ரொம்ப இதுவா சோஷியல் ஒர்க்கர் மாதிரி பேசினாங்க. ஸோ இப்போ நான் ஒரு கேர் கிவர் கிட்டே ஒரு சைல்ட் பேஷண்ட் கிட்ட பேசும்போது அப்படிதான் பேசணுன்றது அங்க கொஞ்சம் இன்ஸ்பயர் ஆனேன். அது
Very
பேஸ்
nice.
பண்ணி என்னோட கான்வர்சேஷன்.
How long back was this, Jonathan? Your
I
accident?
was in an accident 2019 Republic.
Wow. All good now?
Yeah.
You're being more careful now?
Yeah.
Anyway, thank you so much for sharing this experience. It really does help. Don't worry, we love the dog barking. Don't worry. Yeah, Alice, tell me.
It's not easy for breaking a bad news, ma'am. Even counselor கூட அவங்க எவ்வளோ ஒரு நியூஸை வந்து பிரேக் பண்ணனா what they go through. So it's not easy for them also to take that. So some technique skills what we required to break out. நம்ம எப்படி ஒரு கேர் கிவரை ஹேண்டில் பண்ணணும், எந்த சுச்சுவேஷன் நம்ம எவ்வளோ ஸ்ட்ராங்கா இருந்தா அவங்களுக்கு எவ்வளோ ஒரு அந்த கான்வர்சேஷன் பிரேக் பண்றது. So that's what I learned positive.
Nice. Animoli?
Yes, ma'am. Actually, I have never done a role play and all before. This is my first time. And I was a bit nervous before. எல்லாரும் பண்ணும்போது எனக்கு கொஞ்சம் ஒரு மாதிரி பயமா இருந்துச்சு. அப்புறம் பண்ணிட்ட உடனே இப்போ ஒரு கான்ஃபிடன்ஸ் வருது நம்மளும் பண்ணலான்ட்டு. தென் பிரேக்கிங் பேட் ஆல்சோ வந்து அது கூட வந்து லைக் ஆஸ் அ கவுன்சிலரா பார்த்தவங்கன்னா இப்போ சொல்லும் போது நமக்கும் ரொம்ப கஷ்டமா தான் இருக்கும். பட் அதுவே நமக்கு ஒரு லைக் எப்படி சொல்றதுன்னு தெரியாது. பட் இன்னைக்கு செஷன்ல வந்து லைக் எப்படி ஒரு கவுன்சிலர் வந்து கேர் கிவர் கிட்ட பேசணும் அதெல்லாம் இந்த செஷன் நான் கத்துக்கிட்டேன்.
தேங்க்யூ. ஜெயஸ்ரீ?
Ma'am, actually, like the term breaking bad news itself was a big challenge to me. And even while working with the poster with Rama ma'am, I used to wonder how counselors are doing this thing so easily. It could be very challenging for them. But like I had a gist while working in the poster, but when you like taught us and the role plays, definitely it has helped us. And I think, as you said, like nothing is perfect, and we have to like correct it whenever we have time, and we have to accept that what we have done, and we don't have to regret it. Yeah. And I also like this role plays, like everyone had it in their own ways, ma'am, and I had definitely learned many things from each one of the interns here. So thanks
very
to them
nice.
as well.
Yes, very nice. Yeah. Samprita?
I never thought this breaking bad news was such a big deal because I didn't know about this. But எப்படி ஒரு சின்ன வார்த்தை கூட it can affect them. I came to know. You were correcting the words like natural இப்படிதான் நடக்கும், அதெல்லாம் சொல்லக்கூடாது. Even little things matter, our gesture, our posture and everything. And especially the quote you mentioned that if we tell it in a good way, they'll never forget us. And if we tell it in a bad way, they'll never forgive us. That hit me a lot. So, yeah. And this role play was really, really helpful, ma'am.
Very nice, very nice. I don't want you all to stop actually, because role plays help a lot, you know, our inhibitions and that fright inside us, all that fear goes away. And, you know, we can make mistakes with one another. Just remember that. But when you're in a live situation, you can't make any mistakes. I mean, whatever we make, we can't take it back. But in this kind of a scenario, you all can talk to each other, we can correct ourselves, can better ourselves. Okay. Really, all of you all have done an awesome job today. Thank you so much for this opportunity, really, and I hope we can help you all more and more. All the best. Okay. Have a good evening. Is there anything else, Rama and Clara, you all would like to add to them, please?
There are a few questions. They can check on their learnings also. I can post it.
Yeah. Have you put it up?
Yes.
Yeah. 1 minute. You don't have to do it right away.
Yeah, I can put in the group, I think.
Yeah, put it in the group and they can take it from there. All right.
They can check their learnings because there are a few scenarios also.
Okay, fantastic.
Questions, so, yeah.
Nice. Thank you all so much.
Yeah.
You can carry on. We can end the session now. All right. Thank you, Raman, Clara. Thank you so much.
We learned a lot, ma'am. Yeah.
Thank you. God bless. Have a good evening. We'll catch you all. Am I going to be seeing all of you all tomorrow or day after? No. Yes, Jayashree, yes. Jayashree, I will not leave you even after, but I'm just glad with this whole group of MSSW. It was lovely working. Rather, we didn't meet each other, but I still feel that we've been very close to one another. So thank you for choosing Golden Butterflies. Give us your reports. Your certificates will come in sooner and reach you all. And I hope you all enjoyed interning with us. Okay. Please send us a little feedback, each of you all, which will do wonders for us as well. And any areas you think we could improve a little more or better ourselves, don't hesitate, because you youngsters know what is required today. Okay. Thank you. And you all have to thank Rama and Clara, who has always been a big support to both of you all. I mean, to all of you all. And I love my staff. So thank you so much.
Thank you, ma'am.
Yeah. Bye-bye.
Thank you, ma'am.
Thank you, ma'am.
Take care.